So, hello everyone, good evening. My name is Shana. I'm a specialist physiotherapist in cancer rehabilitation and prehabilitation who works at King's College Hospital in London. And so how I became requested or involved to give this webinar is I've been working within King's to see more patients before stem cell transplant as well as afterwards. So a large proportion of the people I see are hematology-based cases. And because King's is a centre, I've had the pleasure to meet probably about maybe between 7 to 10 aplastic anemia patients and guide them through treatment. So that's why I was approached, and hopefully to present to you some of the key points that I would always discuss with my patients anyway when I see them. So what we'll cover today, because I know there's been previous webinars around fatigue. So today we're going to focus on nutrition, activity, and sleep as part of the key themes around health and fitness. So the first question I always ask people is to think about where you are on your own journey, because not everyone's at the same stage when they decide to focus on their own health and fitness. So prehab or prehabilitation can be seen as any time period before a major treatment or admission, no matter what it is. So spending time preparing your body and getting it ready for what's coming next. You also have supportive treatment. So some people will obviously be going through various treatments as an outpatient or even just transfusions to help support them. And then you often have hopefully a period of recovery after any major event. The time to rehab is different for everybody. Sometimes it's not the right time to get started, depending on your own circumstances. And so the rehabilitation phase for some people can last many, many months. It's not over in an instant. And finally, then what hopefully we'll be touching on today is the fitness phase, or people focusing on their health and well-being and return to what they would call fitness or their activities that they focus on the most. So it's important to acknowledge that with any treatment, including aplastic anemia treatment or cancer treatment, you can go backwards and forwards between different stages. It's not always one continuous circle. And maybe, in fact, you feel ready to skip straight ahead from recovering to get fit again. But it's not linear, and it certainly doesn't always stop for a lot of people as well. You can come back into it.
Good evening, everyone. So my name is Alistair. Back in 2012, was diagnosed with aplastic anemia. That diagnosis changed to hypocellular MDS. And back then I was anemic, but my symptoms were managed with EPO and GCSF injections, but my platelets were very low, about 20,000. But I was able to live a relatively normal life for the next 8 years. I didn't cycle or things like that, just because, not that I was a big cycler, but just avoided any issues with my low platelets. But in November 2020, so the first year of COVID lockdowns, my blood started to deteriorate. My bone marrow wasn't working effectively, and the decision was made that I should have a bone marrow transplant. I was scheduled to have a transplant at King's in 5 months' time, so in April in 21. And so once I had sort of got my head around that, and I knew I was going to have a transplant, I sort of started a really focused prehab program. There was two main things I looked at doing. One was really increasing my walking. So very simple, very easy for me to do. It wasn't risky for my low platelets, and so I really stepped up my daily walking. I was averaging about 3,500 steps a day before then. Obviously it was COVID and we're going to work and the like. Then for the 5 months of prehab I stepped up from 3,500 steps a day to about 6,000 steps, so almost doubling my daily step count. The second thing I focused on is I started with a personal trainer, so Mark, and Mark specializes in cancer prehab and rehab therapy. I found him online, and he works in my area, and it was great doing that. He came to my house twice a week, 30-minute sessions with nothing crazy. It was body weight using a rubber elastic bands and 2 10-kilo dumbbells. He completely tailored my program to my condition. He was very experienced in dealing with people with health issues such as cancers. He was able to do it at my home, which was good because I was isolating. Did not want to risk getting ill before a transplant. I didn't want to get any viruses from the gym or anything like that. And we did it at a pace which was that I could keep up with. So I was quite anemic at the time, so I would get my heart would race and I would get out of breath very easily. So we just kept having breaks and moving through that. But overall, I had a significant improvement in my strength and my stamina, and it really, like, through that process, I put on 7 kilos of weight, mainly muscle. I also started eating a lot more, a lot of protein, and overall, it really got my mindset a lot better. A lot of walking really helped with that, and just the exercise really got my mind in a good spot. And I felt that I had done everything I could do in preparation for the transplant. So that helped just mentally with me prepare. So physically, I was feeling good. Mentally, I was feeling ready with that. I then had my transplant in April 2021. I had a rather unusual experience with my transplant. I ended up having 3 transplants in 2021 and spent about 6 months as an inpatient at King's. It was mainly, I needed 3 because the first one I got sick with paraflu, so it didn't last. The second one didn't engraft, but luckily the third one did engraft, which was great. But I was quite vulnerable for a long time in isolation in a hospital, single room. And after that, I had a very extremely rare post-transplant complication where I got lesions in my brain and I lost the mobility in my left leg. I couldn't move my left leg, couldn't speak. I lost my memory for a few weeks. So I was dealing with that as well. So overall, I think like during my treatment, I did take exercise bands into hospital. I did have my Apple Watch, which counted my steps. So I was focused on using them a bit, but to be honest, I didn't do a huge amount of exercise in the hospital. I was quite fatigued and tired and just dealing with the chemotherapy and conditioning and the transplants itself. And because I was in hospital for such a long time, I lost huge amount of muscle. Not that I was extremely muscly to start with, but I did lose muscle, a lot of strength. But I didn't lose a great deal of weight, so I basically substituted muscle for body fat. I was very fortunate that I didn't ever lose my appetite and I could eat continually, which also helped with my putting up with the long sort of treatment period. I was discharged in December 21 after basically starting my treatment of my first transplant in April. I've been at home now for over a year. My blood counts are completely normal. My immune system is well on the way to being strong again. And then I started my rehab at home from the January of last year, and I was starting to learn to walk again. I was using a Zimmer frame because I lost all my balance. My left leg was very poor. And I started doing 2 15-minute training sessions over Zoom with the NHS was one and my trainer Mark was the other. But it was 15 minutes. It was not much at all. And it was really, really simple activities like standing up and sitting down, or just lunging. It was all all body weight. It was no actual weights or anything. It was all, standing on 1 foot and stuff like that, which at the time was extremely challenging to do so. But now I'm back doing 30-minute sessions. I'm doing my weights again. I'm walking fine. I've started doing park run in the common. It's a 5-kilometer run. I walk it. They're incredibly accommodating to everyone. So walking park run in an hour is fine. And on top of all that, I had a lot of holistic long-term support from a whole range of therapy specialists, from such as Shana helped me along the way. The Kings, the NHS community teams, all provided input in helping me with my rehab and checking in time to time how I was going. When I first worked with Shana, I was able to do 3 stand-up, sit-downs in a chair in a minute. And months later, the rest was recently, I've been able to do well over 30. So a huge improvement into simple stuff like standing up and sitting down. But I think overall, my takeaway for the whole thing was the prehab work was incredibly helpful for me for a few reasons. I think it got my mental health in a really good position. Just being exercising, feeling like I had prepared. And my transplant journey ended up being much longer than I had anticipated. So having the extra strength and stamina to start, I'm convinced that it gave me a lot more longevity in what I thought was going to be a few months, a month in hospital and then 6 months at home. It ended up being most of the year in hospital, and now I've been at home for a year, and I hopefully will be starting work again soon. Overall, I think it was just a really good preparation for the journey, which took some twists and turns, which I wasn't really anticipating. But as a quick whiz around my 2021-22.
I think you undersell it slightly, Alistair. I think you went through a lot after the 3 transplants, and even touching base with you between some of them, you did a huge amount of work in 3 to 4 months before you went in, which is what we know helps from a prehabilitation perspective, and that's kind of you did that all on your own back. I didn't do any of it with you, so just to put my hands up and say that to other people as well. It wasn't my plan. It was definitely Mark's. But developing that program and that kind of habit, and being able then to restart and not just stay back and say, oh, this is just too hard. And the fatigue is a massive issue for a lot of people as they're recovering, and how we build it up as well. So I'm hoping to take elements of what you said and share it in terms of the rest of the presentation to hopefully cover different aspects of what I've seen aplastic anemia patients encounter, whether it's been before transplant, after transplant, having just transfusions as you did initially, but also going through, I think ATG is another common one as well. So I'm not going to go into specifics, but give you more of a generalist kind of point of view within that sense. Aplastic anemia and exercise, what's the evidence? So how do we know if it's, does it work? Or do we have any evidence about what we should be doing, what we shouldn't be doing? Because a lot of what Alistair did was done guided by a cancer exercise professional. And so when you look up aplastic anemia and exercise on a common kind of, medical search engine, you get 4 results, and not all of them are relevant. So we actually don't have a lot of studies put into this population in terms of examining exercise and its efficacy, and how to do it well, how not to do it well. However, when you then search for stem cell transplant and exercise, thankfully there's a lot more stem cell transplants happening. We've got a bit more results, and again, not all of them specific, and it was a very crude search. But aplastic anemia patients are often counted within stem cell transplant, and hypoplastic MDS patients can be counted within some stem cell transplant exercise trials. So what's important to know today is that this presentation is based upon experience by me of treating and developing programs with hematology patients. As I said, the evidence available, we have one person wrote up about their kind of aerobic training program they did with an aplastic anemia patient. They've also, I think, a few associations done surveys about fatigue and symptom burden, and quality of life is really important for people. And the benefit of exercise and allogenic stem cell transplant, which is obviously where you get cells from somebody else. That research is growing and does include small numbers, but none of them specifically narrow in on aplastic anemia. So that's my kind of caveat around everything we're saying tonight. So physical activity in cancer patients, this has been analysed and looked at, and the Association of Oncologists in Australia have actually written the biggest piece of work where they looked at saying that we should have exercise as part of standard of care for all patients. And about 80 to 90% do no strengthening activities when they're going through cancer treatment, which can obviously include chemotherapy and radiotherapy, and 70% don't meet minimum activity levels. But when they look at how physical activity can help people overall, they've shown that actually it can reduce the risk of cancer mortality by almost a third, and that's specifically in larger populations like breast, colorectal, prostate. And when you compare people in terms of cancer coming back, and again, these are more kind of solid tumor populations, they've seen that a reduced risk of cancer reoccurrence happens for those who are meeting guidelines versus those who are least active, again, by almost over a third. So it's been shown to be really helpful in both aspects. And you're probably saying to yourself, what exactly are these guidelines that they're talking about? Well, it's our standard physical activity guidelines, which are aiming for 150 minutes per week of moderate intensity aerobic activity. So things that get your heart going, or 75 minutes of vigorous activity, so your heart going quite fast, or you can combine the both. And then you should also be doing muscle strengthening twice a week. So that's actually for all cancer patients, but also all healthy adults everywhere from, most conditions is what we're trying to aim for and build people up to. So it's important to know your body well, and you are your own expert. So do you need support or clearance from your medical team, an exercise professional like Alistair tapped into with some expertise, or a physiotherapist? And we have so many different systems, and lots of us come to treatment not just with one thing going on. So it's important to realize that if you have other issues, that sometimes you will need more support, and it can be harder to get started on your own the more issues that you have in terms of both your mental and physical health. And that's often the people I see are people who have other conditions going on that actually just telling someone to go for a walk and get active is actually really difficult, and they need more guidance. So it's important to realize that before you start any physical activity program as well. So I had to include some science because it wouldn't have been a physio presentation without something like that. So the most important question I normally ask people is, do you know what happens when we exercise and what happens to our immune system? So our immune system is made up of lots of different components, some of which you kind of hear thrown around when they tell you your blood results, and some of which you don't. One of the first ones to point out is our T cells, which are part of our defense system. And T cells are what you possibly have heard in the news more recently as CAR T or CAR T treatments, which is where they genetically engineer your T cells to fight certain cancers. So they have looked at T cells and aging. And so they've compared people who are what they would call masters athletes. So people in their 60s and 70s who do a high amount of exercise like triathlons, rowing, running. And they actually said their T cells were similar to those people who are aged between 20 to 36 years. And that's when they compared both side by side. So being active really has a good effect on those cells as well. The next one is my favorite kind of term for a cell. It's called a natural killer cells, which sound really kind of responsive. But these are cells which are really do respond to acute and kind of chronic exercise. So people who train all of a sudden and people who train over longer periods in both healthy individuals and cancer survivors. So the best way to explain it is the exercise likely influences them and kind of remodels them a little bit to make them better at acting against malignant cells, and so they're able to better recognize them in that capacity. This is what they believe exercise can have an influence on. And finally, neutrophils. We have a transplant to hear all about neutrophils, whether you have any or you don't. And so they're a key part of our defense system. And our neutrophils are what have to engraft before you can leave hospital after transplant. But interesting, when they've looked at kind of healthy people, when they looked at older adults who do at least 10,000 steps per day, when they tested their neutrophils and how well they were at fighting infection, they were better at doing that than people of a similar age who only did 5,000 steps per day. And they've also looked at neutrophils in terms of studies with people with other autoimmune diseases to see how they respond to exercise, and most of it is positive. So that just gives you an idea about different actions that can happen within our immune system, which is why I think some of the evidence that's coming out in stem cell transplant is that people who are more active and get going after transplant tend to create an immune system quicker than those who have maybe lots of complications and end up in bed or unable to walk or move. But this is just kind of evidence that they've just started collecting when they do exercise with people with hematology conditions. So what does aerobic activity or exercise kind of mean for you? So the great thing is most of us tend to have smartphones, and there's lots of different icons depending on what phone you have that measure your step count. So you don't need to buy a fancy watch or a Fitbit. And the main thing to note is that moderate intensity, you can look at it in steps. So it's about doing about 1,000 steps per 10 minutes is what the American Association estimates. And then a talk test is also something you can use. So can you talk to someone while you're briskly walking? And if you can talk really easily, you're probably not walking fast enough. But if you can't talk at all, if you're only able to say a few words, you're probably heading into more of a vigorous intensity. And so this is obviously moving a lot faster, and obviously most people would think of running, for example, so about over 100 steps per minute. And it's important to note when you look at heart rate, there's kind of different, you can estimate your kind of heart rate based on intensity, and this is in normal people. It can be calculated using any sort of calculator normally online. However, it's important to note that when you're going through treatment, heart rates can change rapidly from day to day. But we do have some heart rate guidance as well about what you can do for aerobic activity. So again, anything from walking briskly with family or friends. Some people, especially in London, try to find the hills to make it more of a more interesting walk and more vigorous, but also kind of running or moving very quickly and getting your heart rate up as well. So the most common question I get is, what about my hemoglobin? What about my levels? How will that affect me doing exercise? So what they have looked at is the amount of hemoglobin. So these are the cells that help transport oxygen to the muscles around your body. It does have a strong relationship with what people call your VO2 max. So you might see pictures of athletes and Olympians kind of getting their VO2 max tested, which is an exercise test performed on a treadmill or a bike, where it actually provides data on how much oxygen, maximum oxygen you can consume during exercise. And so of course, if your hemoglobin is quite low, that test doesn't perform as highly. So within cancer patients, we have some guidance on hemoglobin. And so this would be kind of if someone tells your hemoglobin is 80 or below, that would be kind of around the severe anemia. And what we need to consider is acknowledging that your heart rate may get raised even before exercising, or that will raise really quickly. Watching out for feelings of dizziness, and this is where being hydrated becomes really important. So having enough fluid on board. You start small and you know your symptoms and you monitor how hard you're working. As Alistair said, you had to take really frequent breaks if your hemoglobin was quite low. And also most people will be knowing if they do need a transfusion or if they don't. And it's often dependent on the individual. There's no evidence to say if you give people more blood to top them up to a certain level that they will be able to, walk a better distance or do a test better. We don't have any evidence around that. But a lot of people have personalized plans and transfusion plans based on their condition specifically. So the main thing when your hemoglobin is really low is short periods of aerobic activity will be easier than trying to go for a big long 1 hour walk. And you've got to focus on how you manage your fatigue and how you manage your energy, because you're more likely to run out of energy or to get tired more quickly if you get breathless and your heart rate picks up really quickly as well. So this is my top tip. I don't have any evidence to show that what we're doing is blood doping, which is actually something you may have heard of in the sporting world of athletes giving themselves red blood cells specifically, not necessarily hemoglobin, and how it can affect their performance. But what I've advised some people to try is timing their aerobic activity with their transfusion days. So if you get a transfusion on a Monday, a Wednesday, and a Friday, you're better off trying to go for a walk, either obviously directly after your transfusion or the day in between those transfusions. It's very personalized. I've had some people who say it worked really well for them, and some people just said, no, I didn't really feel a difference. But then you're obviously going to do less intense activity right up before you're going to have a transfusion. So if you had one on Friday, it would be unwise to go for a really hard walk on the Sunday when you're immediately due a transfusion. And most people tend to measure themselves by their flight of stairs, if they have one in their house, how breathless they feel going up their flight of stairs. But it's obviously fatigue is also an important factor at this. So that's something I've used for some of my aplastic anemia patients, and also acute myeloid leukemia patients. Some of them found it actually really helped give them structure to their week as well. So the important thing to note when you have low hemoglobin is you're also going to have breathlessness. And when people are actually under their bodies under a period of low hemoglobin for a long period, I have encountered people who get really scared of being breathless, and they start thinking and they start panicking, and they start feeling that it's just going to get out of control if they do anything out of the ordinary. And so this is a model we use with people with chronic breathing difficulties, but it still applies to other conditions, because when you are not breathing properly, or your breathing rate increases, you are going to be using more of your muscles to help you take a deep breath, which then of course can use up more energy. You're going to be feeling a bit more panicked trying to push yourself, and so therefore you're probably not going to do as much. You're probably not going to try to run for a bus again because it kind of freaked you out a little bit, and then you start doing less and less over time, which is where a phenomenon called deconditioning comes in. So you start losing muscle, and this can happen very slowly over many months or years for a lot of people. So it's important to connect with your breath. And for most people, that is doing simple things like taking large breaths. So in through the nose and out through the mouth, and trying to do it for a count of 3. And you're either focusing on your ribs on the outside, expanding outwards, or you can do like a yoga style breath, focusing on the rise and fall of your tummy, and doing 4 or 5 breaths, and then relaxing and letting your breathing go back to normal, and repeating a few times when you feel your breathing becoming elevated. And with one gentleman I met, just learning this technique meant that when he tried to do something, he could collect his breathing and feel more in control, and therefore he was willing to start trying to do more things without being afraid of if his breathing rate would increase. So how do I measure kind of how breathless I am? Like, how do I know if I'm pushing myself enough or I'm not pushing myself enough? So we do use a scale I tend to use a 0 to 10 because it's a bit easier. So the idea is, if you can use this scale, you can follow then and rate yourself when you're doing an activity. And if you can see in the red box here, or even in the box where it states severe or very severe, if you're feeling that breathless, you're probably likely working in a more vigorous intensity zone when you're moving or exercising. And you're feeling somewhat severe, moderate, slight, you're probably working in the right kind of moderate zone, and you're probably able to talk to someone, but it's not feeling very comfortable. So that's often a scale I give people, so you don't need to be watching your heart rate monitor exactly. And it does tend to work in terms of pacing it to your body, because breathlessness is really important to guide how far you feel you should push yourself. So getting started, at various stages, it's always hard to know where to start. And the first question I normally ask people to ask themselves is, do you have enough energy to do everything you need to do in your day before you start exercising? Because we're all in different circumstances, we're all living with different levels of support. And if you're lucky enough to have all the support that you need to care for family or children, then that's great. But some people have to do a lot more in their day before they even then focus on themselves. And that's an important part of energy conservation. And if you're not quite at that level where you feel you've got a little bit of excess energy to put into exercise, then you may need to rethink about fatigue management as your first port of call. But simple things can be done. So you can use the stairs instead of the lift when you go to a building or to hospital. You can set a timer indoors and just try walking for 10 minutes at your own pace around your house or around your lounge. And you can just look at your steps. You don't need to analyze them every day. You can look at your phone, measure them, and just see what one day felt like and how you felt in terms of energy compared to another one. And often people will compare hospital days to non-hospital days in terms of their step count, depending on how big your hospital or how awful the parking is, especially in London anyway. So the next step would be moving on to say to yourself, okay, I know how many steps I'm doing, and I'm going to actually try to increase by about 10% per week. So it's not huge leaps and bounds. So if you're only doing 1,000 steps in a day, that's only going to be 100 steps extra that week, rather than bumping it up a huge amount. Another easy way of fitting it in is walking part of the way home from hospital. So could you walk to a further place where you've parked the car? Could someone pick you up on a different road to make it a few more steps as part of your journey? And could you start finding a time of day where you do have energy to try a walk with a family or friend? So you can add it kind of into your social activity, or a dog, obviously, if you have one. And then when you start to move on and feel a bit fitter, one of the really nice programs that some people have used is the NHS Couch to 5K program is readily available online, and it's quite a number of weeks. And what I get people to do is when it says jog, you just do fast walking. When it says walk, you just walk really slow. And when it says normal walking, you just stop and rest. And it's very nicely paced to build you up. And it means you can explore local parks. If you feel well enough to go explore hill walking and starting to go up and down, gradients to help challenge your heart and your lungs, that's another way to progress yourself forward. So you can see it's not all about aerobics classes and HIIT workouts. It can actually be much more steady than that. So physical activity and strength training, I often think people think of Arnold Schwarzenegger when they think of strength training and think of people who are like really big and muscly when it comes down to it. And that's just one component of strength training, but there is some like key kind of themes that we have, even from someone who's a bodybuilder all the way down to someone who's trying to get strong. And it's called the FIT principle. So you're looking at the frequency, and we're aiming obviously to spend a little bit of time, 2 to 3 days per week, and always have a rest day between sessions, no matter what you do. You can start with an intensity, you can start low, you could start even with only 2 to 4 reps, which I'll go through in a little bit, or you could start with moderate repetitions and find a weight you can lift, or find something you can lift and be able to repeat it over and over again. So how much time are you going to spend on it? Well, you probably want to do at least one set of 10 repetitions on all your major muscle groups. And your major muscle groups, as you can imagine, are your arms, so around where Arnold Schwarzenegger's big biceps and triceps are, and around your legs and your bottom muscles. They would be your main major muscles. And also then you've got to think about the type of exercise. So if you have poor balance or you don't feel very balanced, you probably need to do something in a chair or sitting down, or holding on to the chair with weights. And as your strength and balance improves, you might want to add some free weights that you can hold and move with. And as well as that, as Alistair said, you can also use resistance bands. You can also use body weight. You don't need to add anything to your body, starting with things like push-ups and squats. And when it actually comes down to simplifying strength activities, it's just almost 4 or 5 main moves. It's pushing things, it's pulling things, it's squatting or bending down, and it's lifting or kind of hinging. So if you think about the movement you make when you go down to lift a washing basket, you hinge from your hips and bend forwards. And finally, carrying things, which is exactly what we do when we get our shopping. So it doesn't have to be complex and fancy moves that you see people doing in gyms and videos. It's all regular movements that we all did as human beings for a very long time. So how do you get started with strength? So the first thing I normally get people to ask themselves as well is, have you lost weight as part of your diagnosis and treatment? Can you stand up from a chair without using your hands? And as Alistair said, you could only do that 3 times when we started. Have you had a recent or near miss fall? So is your balance more of a concern to you before you get onto your strength? And another really random question I ask people, can you do a press up? Can you press your own body weight? Is that even possible? So we do want to make sure we focus on balance and strength and falls prevention, because falling is not a part of any treatment. So there's a really good kind of 6 starter exercises from the Chartered Society of Physiotherapy I recommend to people. And you can do this at all ages. It doesn't have to be just if you're, over 65, for example. It can then be nice to start very simply thinking about things like ankle weights. There are weights that you can attach around your ankles or your wrists with Velcro, and they're quite light. They can be as light as half a kilo. And walking around with those on your legs can mean you start to feel very light when you take them away. Starting to carry shopping. So if you haven't been carrying shopping or other people have been delivering your shopping to you, can you start to carry small loads in both hands? And another one I've used with someone who was adding load to a backpack. So he didn't want to try lifting huge weights, but he started adding weight to a backpack. So when he went on his walks, he was still adding load to his body. And for some people, I kind of asked them, how much weight have you lost? Okay, well, let's add either half of that weight onto your body, or maybe depending on how much it is, if you've lost 3 kilos, 4 kilos, let's start you holding that weight and see how you feel. So it's not taking, getting someone to look at a massive weight, I'm never going to lift that. It's putting in perspective based on the person in front of you, because if you have lost a huge amount of lean muscle, it could take a little while to build up your ability to carry that weight again. So when you move forwards, you look at the use of free weights, so little hand weights or things you can hold, even kettlebells, something that's giving you load, and you need to have load in order to get stronger. You probably have to add a bit more structure and a guide to your program. So whether you need, guide from an exercise professional, or need to think a bit more carefully about what exercises you're doing and why. Someone I talked to wanted to get their legs back looking the way they wanted them to. Another person I talked to said they really missed having a chest and arms, and that made them feel a lot worse about themselves. So it's all based on your goals. And if you are starting to lift free weights, if you're training 2 to 3 times a week, you would try to increase the weight by no more than half a kilo to a kilo per week. So depending on how strong you feel as a person, but also depending on your background of training as well, because some people will have obviously been to the gym and lifted lots of weights before they got on well. So it does depend on your experience about how heavy you're going to go. So, as I said to you, you don't have to lift weights for reps and reps. This is one of the strategies I use for people when they're fatigued. So if you're tired, you don't have a lot of energy. So we use something called cluster sets, and they've been using this in other studies with prostate cancer survivors as well, and lung cancer patients. So the idea is about taking a short period of rest between repetitions within a set. And the idea is that you're trying to decrease how tired you feel when you do something all in one go. So just kind of pacing yourself. So we can reduce the overall fatigue to your body by using these sets. And you can see what a traditional one would look like. But you can see here, you'd kind of do 2 reps and rest for 30 seconds, do another 2 reps, rest for 2 minutes, and build it up like that. And again, you need to have a weight that's heavy enough, because if you're just lifting a can of beans, you're probably not going to feel like you need a rest after 2 reps. So this is also appropriate to the load that you're carrying. So people don't really know if they're lifting enough weight. Like, how do I know if this is hard enough, if it's going to make a difference? And so there's lots of different scales I'm going to introduce you to, but this is quite a nice one, which is the rate of perceived exertion. So again, it's how difficult you feel it is on your body. So if it's feeling like light, like you could lift a can of beans and go for hours, it's probably only a rate of perceived exertion of 2 to 3. And then it goes all the way up to a 10. So if you're lifting a really heavy weight and you do 5, and I say to you, right, how hard is that if I asked you to lift 1 more and you're like struggling to even get your arm above your head? It's probably near enough to a 10. So what you're going to be aiming to do if you're fatigued, you're probably going to want to be in moderate activity. But if you're feeling a bit better, have more energy, you're probably going to be wanting to go up to 7 to 8 in terms of your rate of perceived exertion, depending on how you feel. So another common question I have to preempt for people is about muscle soreness. So how do I know if I injured myself, or how do I know if it's just my muscles building? Because to make our muscles bigger, we have to cause micro tears in them to like reseal and reheal bigger. That's what that's what bodybuilders are doing, is they're breaking their muscle each time to try and get it rebuild. And obviously we're doing this on a much smaller level, and it's called delayed onset muscle soreness, which is why you don't do strength training 3 days in a row. You take a nice day off in between. So it feels a bit like a burning or an aching. It will come on probably the day after, and it might last about 1 to 2 days, but some people can find if they're getting started, it lasts a bit longer. And it does improve with going for a walk, stretching, taking some rest, and an injury will feel much different, and it can be often sharp. It'll be sore as you're trying to do the movement, and it would get worse if you tried to stretch or try to walk on it or climb the stairs. And for example, that's just some general guides, but I tell people if you're starting to strength train, try to make sure you're not feeling some soreness in your muscles beyond about 3 to 4 out of 10. If 10 out of 10 was the worst pain or ache you can imagine, you're unable to get out of bed in the morning kind of level. So another question, what about my platelets? I've got low platelets. I was being told not to do very much. What about that? So platelets, as you can see here, are measured in different kind of units, and these are precautions, again, given to cancer patients. And we only have precautions. We don't have a huge amount of, as I said, data getting people with very low platelets to lift weights and see what happens. But this is what I've seen from my experience. So this is what we guide physiotherapists and other professionals. So as you can see, it gets a bit easier as you go down. So you can obviously, once you have platelets over 50, you can exercise and lift weights as much as you feel you're able to. You might want to just focus on flexibility and light walking if your platelets are a bit lower. And the main thing we obviously want people to be aware of is we don't want you falling. Again, if you fall and you have low platelets, these are parts of your body that help your body clot, which is why some people can experience kind of nosebleeds quite frequently. And then obviously when it gets below 20, it can be mainly walking, light activities, and many people will have, or many centres will also have a transfusion status or a plan of care if your platelets are that low. But here's the problem. Most of the AA patients I meet can spend many months with their platelets between about 10 to 20, and they're not going up despite, bags of platelets given to them every week. And as Alistair said, he had many years almost at those levels. And so what do you do in that scenario? So what I found is I've added precautions to strength training. So you can strength train, we just need to look out for certain signs. So one of the first ones is petechiae, which look like little small bruises on your skin, so little spots. And if they're coming up, it's probably a sign that you probably need to either obviously get a transfusion and get an assessment, but that maybe that exercise or that workout you tried didn't suit your body. Another one is bruising, and I think hopefully Alistair won't mind me mentioning, I remember he said an exercise band recoiled and hit him back, and the worst that happened was a massive bruise on his shoulder blade. There was nothing more than that, just a really nasty looking bruise that took a long time to go away. But that's something we would look out for, and why I probably would steer away from exercise bands if your platelets are very low. Holding free weights can be a bit easier, but it's just something you need to be aware of. And another thing you look out for is any joint swelling. So if your ankles or your knees or something becomes swollen, this is actually someone with what they call like an elbow bursitis, an electron bursitis, but I've actually seen it happen to quite a few people with low platelets. And I don't know why. I've seen like three or four of them. And I think it's because they spend a lot of time leaning on their elbow for long periods, whether they're on the computer or they're talking to someone, and then they lift it, and it's obviously had a lot of pressure. And because their immune system is not normal, it's not able to manage that pressure accordingly, and it swells. And for most of them, it's not painful. It's just there, and they don't know why it's there. But it's something, as I said, I've seen in people with low platelets, and it just means you're probably not going to be trying to lift a heavy shopping bag while it's there. You're probably going to take it easy and work on your legs a bit more. So hopefully that makes a bit of sense. So lines and attachments, there's two most common ones that we have. So a PICC line is kind of a thin tube in your upper arm to give you medication. And they normally state that you should be trying to avoid kind of repetitive exercises, so doing lots and lots of reps using really heavy weights with that arm when the PICC line is in place. And most people, I would focus, if you look at where the PICC line is placed and where your arteries and veins are, you're not going to be trying to stretch a weight all the way out to the side, because that's going to put maximum stretch on the line. You're probably going to keep things quite close to you and be able to do an exercise that keeps everything nice and close to your body. And again, it's dependent on your type of line, infections, and obviously you're monitored very closely. So if you have any issues with an infection or with a blood clot, you're obviously going to stop exercising until that's solved. Another thing I've seen is people sometimes get lines put in for a very long time. They should be changed every 12 to 18 months. And some people get shoulder pain or arm pain related to the fact their line hasn't been changed on time. And that's something I've looked out for. I've seen lots of people post-transplant with one-sided shoulder problems. And that's normally because their line was in that side. And it doesn't, they don't move their shoulder at all. So it gets really stiff. A Hickman line, in contrast, is more of a central catheter used for giving multiple treatments at the same time. So they've got obviously little openings. As you can see, it's located much more centrally and close to your heart. So they mainly want you, if it gets put in, you're not supposed to obviously do any heavy lifting or anything really strenuous for about a week. And they say things like tennis, golf, anything that's going to really make you stretch and move all at maximum reach should be avoided. However, I haven't met many people who've asked me to go play golf while they're going through treatment. And so yeah, they also say you cannot swim with it, and they give you lots of precautions about how to cover it. So as again, I would say keep those strength movements to your arms by your side. You can add load to your body in different ways. You can put weights in a backpack instead of putting things on your arms. You can put ankle weights on instead of, holding heavy things. And you're trying to avoid, again, the extremes of shoulder movements within that capacity. So lots of ways you can still adapt things. So protein is, as I work with a dietitian, but I am not a dietitian, so I focused on some of the key messages that I still get people to think about when they're starting to train. And you don't put 7 kilos on like Alistair did without eating a lot of food. And how much protein do you need is often a question that we get. And we do use the guidance for cancer patients because of the types of treatments that they're put through. And you should be eating at least 1 gram per kilo per day. And if possible, 1.5 grams. But if you're actually older, if you're over 60, sometimes even over 55, depending on how you feel, you should be eating even more protein to help maintain your muscle. Because as we age, they think about maybe once we're over 30, 35, depending on how active you are, we do lose a small percentage of our muscle strength every year as we age if we don't train it or use it. And that's a process called sarcopenia. So giving you an example, an 80 kilogram adult, so that's probably someone around 13 stone, would need at least 80 grams of protein, if not a bit more. So I went for 100 grams. And what does that look like? Well, if you eat animal foods, it will be things like lean chicken, eggs, good high protein yogurts, even maybe any kind of protein-based snacks. That's, I think, some biltong or jerky there. But equally, you can get quite a lot of protein through plant-based sources as well. You just have to think a little bit more about what you're eating in terms of pulses, nuts, tofu's obviously really good as well. So there's many different ways of getting protein in your day and measuring it out, but it's something to be aware of to check yourself whether you're eating enough within your day. And when's the best time to have it? Well, the jury seems to be out on whether you should be having it before workout, after workout, whether it makes a difference if you're an expert weightlifter or an athlete, or if you're just someone getting started. But basically, you just need to have it in your day. You're probably going to end up eating it sometime before your workout and sometime afterwards, but you just need to make sure you're getting enough across all 3 meals if possible. And that will help aid kind of lean muscle mass, as well as also muscle building. So be conscious if you're trying to put on weight, you'll probably need to eat significantly more than you possibly feel comfortable with, and focus on that as part of your goals. So vitamins and minerals, again, another recommendation is that vitamins and minerals should be supplied in amounts approximately equal to what's the recommended daily allowance that we hear about. And within cancer patients, they discourage using high dose micronutrients, so taking massive tablets, if you don't have a deficiency. And so some of the key ones that we obviously think about with people going through treatment is vitamin D. Believe it or not, nearly every person who's a bit older who gets admitted into hospital when it was during COVID, for example, had vitamin D deficiencies because they weren't leaving their house, they weren't going out. They didn't eat enough to get it naturally from their diet. So vitamin D we do need all year round. Another one is vitamin B12. Originally, we used to get this from eating things that had soil on them, which we don't do anymore because we wash our food so thoroughly, but it has multiple roles, including helping to form our red blood cells. And then finally, minerals and micronutrients. Some people would have been through scenarios where they needed magnesium, potassium as infusions, depending on their balance and within their bloods. So if people are worried that they're not getting enough of one mineral, they can add it onto your blood test to do a micronutrient, or nutritional bloods is what the dietitians call them when they're looking at how much zinc, copper, iron, vitamin B12 that you need. And it's just an extra tick of a box on some bloods to give you an idea if you are deficient in anything. And if you're concerned about your diet or you are exceptionally fatigued, I have requested this on occasion to make sure we didn't need to refer to a dietitian to address anything that was deficient, to help rehab as well. So when do you actually want to speak to a dietitian? They aren't easy to find sometimes, I'll be honest. There's a workforce shortage everywhere, but they are around, and they do tend to work in cancer-based centres. So you have to ask yourself, have you lost a significant amount of weight in the last 6 months? And so you're thinking like, have you dropped quite a few clothes sizes? Have you lost a large percentage of your weight? Even if you were overweight before, it still counts because you can lose your lean muscle and not fat. And have you lost weight in the last 1 month? So is your weight continuing to go down and it's not stabilizing? And then some of the questions dietitians look for people is whether you have multiple issues that affect you eating and drinking normally. And that can be things like obviously developing mouth sores, being constipated, having extreme nausea, that means you can't eat, a whole host of problems. But those are speaking out to you, you do need to seek specialist support before trying to go and obviously improve your diet or anything like that. I would always say you have to seek guidance from your medical team before taking supplements or complementary therapy options. And a lot of our cancer dietitians would say they spend a large proportion of their day just dispelling myths that people have read about food and cancer. And the same probably applies for aplastic anemia. We don't have any evidence if you take an iron tablet or you eat 5 steaks a day, that it's going to help your blood count. We just don't have that sort of evidence out there. And so you do need to seek guidance because of drug interactions or not disclosing what you're having. We have to be very open and honest with our medical provider rather than keeping it to yourself, if possible. So finally, sleep. So this is a bit of a busy slide, but what you should be thinking of is circadian rhythm. So the rhythm that we live our lives. And if you think of how long we've been around on this earth and that we didn't always have artificial light or iPhones and tablets and screens, we were guided by daylight and darkness. And obviously would have natural light like fire to keep ourselves awake until it was evening time. So we have a natural circadian rhythm that's built into us from cavemen to now. And even when they locked someone in a dark cave for days and days, they found he followed a 24 to 26 hour pattern. So even if you don't see any daylight, you're still on some sort of rhythm. And so it's important to know that built into us is things like melatonin, which helps us sleep, which is what you sometimes hear people taking on long haul flights, which I don't do. You also have points where it affects your hormones and also affects your, therefore, your things like reaction time, and also, believe it or not, your strength. You should be strongest at around 5 o'clock in the evening, so post work time. And then you need melatonin secretion to start as well, to then trigger you to feel sleepy and go off to sleep. So we all have that rhythm, and many things can throw us off that rhythm and affect our sleep. So what we start thinking about when you're trying to regain energy is rather than calling it a nap or a sleep, you can call it a controlled recovery period. And there's a reason that most of the Mediterranean world have siestas, because actually we naturally do need a rest between about 1 to 3 p.m. That's a natural point where things kind of take a dip and you can relax. And another natural time is just after kind of work time between 5 to 7 p.m. So if you're trying to do a 90-minute or 30 to 90-minute rest, those are the 2 time periods to focus on. If you're trying to build up your activity levels to factor in those rests. You don't always have to sleep. You can just lie down, switch off, and not speak to anyone for that time to try and regain a bit of energy if you're starting to train as well. And they're very valuable. I don't tend to recommend people start taking away naps until they feel ready, that they have enough energy to make it through the day as well. So strategies for sleep. One of the important things is to set your body clock with daylight. So the minute you wake up, try to expose yourself to daylight, go into a bright room, don't keep the curtains closed. Try to make sure you're not using kind of blue light or artificial light in the evenings. You're better off with a nice soft light, a candle light, something to kind of wind you down. And I've also added here to know what sort of person you are. So this is a questionnaire you can do about your chronotype. So are you naturally an early bird, or are you a night owl? Because whatever you are, you're probably not going to change that ever. It's probably going to be the way you were in the cave and will be now. So it's important to know that, because it will feed into both returning to exercise, but also returning to work. So telling yourself if you're a night owl, you're going to go for a 6 a.m. gym session is probably setting yourself up to not be a very happy person. Another aspect people don't think about is caffeine control. So that's coffee, tea, energy drinks. And so we're recommended to have a maximum of 400 milligrams of caffeine, which is about, 4 cups of kind of dilute coffee per day, but we really shouldn't be exceeding those amounts. Most people don't realize that you have a natural rise in your cortisol, or the thing that wakes you up in the morning. And if you have a coffee straight away, you actually can suppress that a little bit. So most people should wait at least a few hours upon waking before you have a coffee, and you shouldn't be drinking coffee past lunchtime, midday, or well into the evening. So that's something to think about if you are a very keen tea or coffee drinker as well. Try to form a routine and have a constant wake time, even on the weekends. So you do need to wake up at the same time, go to bed at the same time, and have a really good pre and post sleep routine. So this involves doing things that are not screen-based, that involve you feeling like you're settling down for the evening, whether it's tidying, housework, something that winds you down and makes you feel content and organized, rather than being on a screen or being alert well into the evening. Another aspect that can help with people returning, trying to get normal sleep back, is things like mindfulness and meditation. If you have a Netflix subscription, they've got a lovely kind of a series done by an app called Headspace called Sleep. And I've never made it through the entire series because I keep falling asleep. So it's very good, and it's free. So it can be interesting just to explore what you know about sleep and how to engage with that. And then finally, the other thing to think about is kind of your bed, your mattress, your blinds, your setup, and your room temperature as well. Because if your room is below 16 degrees, that will be harder for you to sleep. If your room's too warm as well, as you probably feel during the heat wave, your sleep quality will also suffer. So all of these things can feed into a sleep, fatigue, and activity diary. So you're not running yourself ragged trying to do everything at once and not looking at your recovery time. Because believe it or not, you will get stronger the more rest you have, the more good sleep you have. If you're someone who tries to exercise and only sleeps 2 or 3 hours a night, you'll probably find yourself not getting the results that you'd wish in terms of performance or the way you feel as well. So to bring it all together, health and fitness is personalized to you. There's no right or wrong way to do it. It's going to be encompassing your type of diet, your choice of exercise, having enough hydration, the right sort of fluids, and not 15 cups of coffee a day. It's going to be based on your immune system, what it's doing at that time, what your goals are, whether it's a sub 30-minute 5K run, or if it's just being able to go on a walking holiday, and also your mental health and motivation. So being in the right headspace and feeling like you've got the right support to be able to start as well.